Welcome back, everybody, to another OAO Members Spotlight. And today I'm very pleased to welcome to the show Dr. Mike Rotholz. So, Mike, maybe you can just introduce yourself to the folks who don't know who you are.
Sure. So I grew up in Montreal. I went to McGill for my undergrad, and then I went to NECO in Boston for optometry, where I graduated in '98. My father's an optometrist since 1963. But I actually only worked with him for a few months after I graduated, moved to Toronto, joined a large group practice, a well-known practice. In that time, I also joined a second practice, so I was working at two quite large, pretty well-known practices with some really great optometrists from whom I learned a great deal. And then in 2010, I branched out and opened my own practice, which I've been running now with three associates, and we're right in Midtown Toronto, sort of in the Yorkville area. That's pretty much it. I've been on the board for, I think, this is my sixth year, possibly.
So I guess today, the topic that I wanted to share with the membership is more of a practice management bent. And Mike, what's impressed me a lot since first meeting you in 2005 when I moved to Ontario was you've got a patient script, you've got a spiel for pretty much any question a patient is going to ask in the exam room. So a lot of times patients are afraid to bring certain things up. There's always that 800-pound gorilla in the room, whether it's ordering contact lenses online or glasses, questions that we're, sometimes afraid to talk about. We dance around them. You kind of seem to hit them head on. My experience with you is you have a script for everything. So what I thought we'd do today is we could share some of those in the exam room scripts. I'll be the patient, you're the doctor. So I'm the patient, we finish the exam, and I say to you, Dr. Mike, I normally buy my contact lenses online. Why would I buy them from your practice?
Well, the first thing that I'd like you to know, and that's important for me as your doctor to inform you, is that the sale of contact lenses is actually a regulated act in Ontario and in most of Canada. So for anyone to sell you contact lenses online is actually illegal. It's in contravention of that act. So only a licensed practitioner or entity is allowed to actually sell you contact lenses in Ontario. At that point, the patient usually says, well, I'm getting them online. How do they sell them to me online? I said, well, the people who sell you contact lenses online are actually not in Ontario. They're in British Columbia, which is the only province that where it's not a regulated act. And since the regulation affects where the seller is and not where the buyer is, they're technically not breaking the law in British Columbia. The laws are in place to protect the public. So I usually ask the patient if they remember faxing their prescription in to Clearly Contacts or 1-800-CONTACTS. They pause and they say, I don't think I faxed it in. They say, oh, so you scanned it in and you emailed it to them. And they say, no, I just typed it in I typed in my prescription. There's a form on the website and I typed in my prescription. They said, well, very much like pharmaceutical agents, medicine that we get in the province, you're required to have a prescription for that. For contact lenses as well. And so can you imagine going to your pharmacist and saying, well, my doctor told me I need to take 200 milligrams of penicillin 4 times a day. Can I have my prescription? Can you give me my medicine? They say, well, no, you can't do that. I said, well, you're not supposed to be able to do that with contact lenses either. They require a prescription. What if you typed in wrong? What if you typed in the wrong prescription? Or what if you chose a different contact lens brand because you felt it was comfortable? The reason you're not allowed to do that is because not all lenses fit the same. So in essence, that law is there to protect you, and the internet has given public a way around that law, essentially putting yourself somewhat at harm. If you get your contact lenses from us, first of all, we tend to be very competitive on price. So you think you're getting a better price, but you should actually, when we're done here, I'm going to bring you out to chat with my staff, and they're going to give you a quote on what your lenses would cost here. Now, on a side, most of my patients wear daily disposables. We are extremely competitive on daily disposables. We scour the internet for their prices. And when patients check in, my staff asks them where they buy their contacts. So when they get into my room, on my sheet, it says that they buy from Clearly Contacts. While they're sitting in my room and I'm doing the exam, I quickly message my office manager that Jeff Goodhue gets his contact lenses from Clearly Contacts, and he's wearing Moist 8.5, minus 450 OU. She goes on Clearly Contacts, confirms the price, And then when we get to the front desk, I say, and could you please give Jeff a quote on his Monday Moist, who Jeff may still be thinking he's buying online. She turns the screen around, shows Jeff what it costs on Clearly Contacts, tells him what it'll cost with us and how much he gets for a rebate, and tells him we actually have the lenses in stock, so he doesn't have to wait for them to be delivered. He can walk out the door with them, and that usually does a good job. I say to them, listen, the speech is very self-serving, and I realize that because the patient knows that I want them to buy from me. I want to get the sale. I'm going to make money. So I always end with, listen, if you're not going to get your contact lenses from me, I'd rather you got them at Hakim, at LensCrafters, at any other licensed entity. First of all, if you ever have a problem, they have malpractice insurance. Clearly Contacts you have no recourse. They're not breaking any laws, and if you have a problem with your contact lenses, you're going to have a hard time going after them. So if you're not going to buy them from me, at the very least, buy them from a licensed entity so that you're protected.
No, I think that's a great. I like how you finished that speech up, Mike, because it may appear self-serving to the patient when you deliver that speech, and by wrapping it up at the end, I think that's a great way to frame it.
Yeah, so I like to soften it a little bit so I don't sound pushy, and I truly am. I mean, yes, I want the sale, but I think they put themselves at some level of risk by buying online, and my job as their doctor is to protect them, right?
Yes.
And to tell them what's best for them.
Exactly. So maybe we'll move on to glasses. So I come in to see you, Mike, as a patient, and I wear spectacles, obviously. I've got a pre-existing relationship. I've been buying from the optician 2 blocks over from your practice for the last decade. How do you handle a patient like that? Do you just hand them the prescription and say, I'll see you in a couple of years for an eye exam? What do you do in that situation?
Well, never. First of all, we all get a little bit frustrated when we have a patient who we know we give great care to. Maybe we've even saved them from some sight-threatening condition, and yet they still buy their glasses from someone else rather than giving us their loyalty. So it always bothers us a little bit. But
so do you get angry at them? Do you feel?
No, I mean, I keep that to myself because I'm there to be their doctor first. They're provider of product second. And so I'm happy to be their doctor. But I don't just throw my hands up and say, well, this guy's only going to buy from Josephson's. He's never going to buy from me. If I say that every year, then every year I'm going to be irked a little bit that he doesn't buy from me. So every year he's coming back, he's affording me the opportunity to take another kick at the can. And so what I tend to do is, first of all, I like to know where they buy from. So I always ask, I say, oh, those are great glasses. Where'd you get them? I want to know, who my competition is, whether they're buying it from the previous OD or whether they're a longtime patient of mine and they get them at a local optical like Josephson's or Career, Spectacle. And so once I know where they're buying from, I get a sense of, who I'm competing with. But I always go through my exam. I say, okay, so we're going to come up, how's your vision? Your prescription's bothering you. They feel they need a change in prescription. So then I'll say to them, okay, so we're going to go through the exam. I'm going to figure out your newest and latest prescription. And then when we're done in here, I'm going to bring you out to the front, and I'll introduce you to my opticians, and they're going to go over with you lens designs, lens material, different qualities of coatings and options. They're going to get to know a little bit about how you use your eyes during the day, activities you do, computer, what your vocation is. And we're going to help you decide on what the best lens design is for you. And then they're going to instruct you on what the best frame is to hold those lenses so that everything works properly, and we want to make you look great. Now, I speak as though, even though they've never bought from me in 10 years, that this time they're going to buy from me. I'm not asking them to go into the dispensary. I'm telling them this is what's going to happen, right? And sometimes you can see they move back. You could read their body language, or they say, well, no, I'm not buying glasses today, or, well, I'm going to go see Bosco at Josephson's. I said, that's fine. But I need you to know everything you need to know about the lenses because I worked so hard to get this prescription right. If somebody doesn't give you the right lenses, or they don't think about the right lens, the frame shape or design for you, or they don't fit it properly, then it might not work. And your vision is too important for your job. So once we're done in here, you'll go speak to my opticians. And then what I do is when I print their prescription from our EMR, I don't print it in my room. I print it in the dispensary. So we have to go to the dispensary to get the prescription. So sometimes they'll say, no, I'm not buying today or whatever. I said, that's fine. They said, you know what, I don't really have time to talk to the optician today. Maybe I'll come back or something like that. And these are, you get a sense, you can read people if these are just excuses to get the hell out of your office, or if it's genuine. So then what I do is I've also, handled and looked at their glasses. I'll say, also, before you leave, David, if you could, I'd like you to just change Jeff's nose pads because they're torn a little bit and they're starting to discolor. And I'm like, Jeff, we're going to just do that because your old glasses are still going to be your backup pair, and there's no charge, right? Or I want David to just adjust your glasses because until you get new ones, these are not sitting properly. They're a little askew or something like that. Anything to give them, to get my dispensary team to have 1 minute to have a conversation.
Yeah, no, I like that. It's a great idea. I mean, I think this is a tough conversation. It's very easy to get resentful with patients like that, but I like your attitude. So I think that's great.
I'm trying to show them that we're doing this for them. They need to know about lenses. So when they go to Josephson's and Josephson says, you should have this lens or this lens, they could at least say, well, my doctor's office said I should think about this lens. What do you guys think? Because I do a lot of this. It makes them better educated, and it really, so again, I try to be less self-serving. Yes, I want to get the sale, but I feel in order to come off as less self-serving, it's about educating them. It's part of the exam is getting the education about lenses and frames. Then the closing piece is, I have fantastic dispensary staff. You must have people who can close, because if you can get them to the dispensary, but your staff are not, salespeople, then they might not close. And I would say probably 40 to 50% of the time, patients who typically don't buy from us will at least consider buying.
Yep, and I think, and if you, like you said, you frame it, you're doing the patient a service. You're educating them. So if they do go elsewhere and they have another experience with another optical, they may look back and say, you know what, Dr. Mike's staff, they really know what they were talking about, and maybe they'll come back. So when you frame it that way, I think it works pretty well.
And the last thing is, you said I always have a speech for something. You always have to have an answer. So a lot of times, especially with male patients, they'll say, well, no, I can't take glasses without my wife or my girlfriend. I can never do that. Not a problem. We're going to get you to narrow it down to 2 or 3 frames. You're going to leave us your visa number. We're not running anything. Take them home. Show her, model it to your friends at work. Let them tell you which ones are best. Try and have it back to us within 2 days.
No, it's a great idea. Right? I like that.
And always works.
Yep. So now I come in, I want to buy my glasses on Clearly or Zenni. I just think, you know what, busy guy. I don't have time to hang around for another hour to look at glasses. I'm just going to get them online. It's just convenient. Price is cheap. Why? What's Mike, Dr. Mike? What's wrong with doing that?
So this response always gets interesting comments when I share it with colleagues. But basically, what I say to patients is, glasses versus contacts online. Glasses is a much worse purchase online. I say to a patient, you have an intricate prescription, and you can say that to anybody, whether they're -9 with a -4 SIL or they're a -2 sphere. It's still a prescription, and any prescription can be considered intricate. It has to be made properly. PDs, height, space curve, face form, pantoscopic. So you have an intricate prescription, and if your glasses are not made right, you have to remember your eyes. We try and center your lenses on your pupils. And to do that, that's why when you go online, they ask you for that PD measurement, but that's only one measurement. What if your glasses sit like this, or they sit like this? And because you can't try a frame on that's online, they're never going to get it right. So the heights may be down here or down here. And, there have been studies that have shown that a lot of these online glasses are not made accurately, even with the right measurements that were sent in as a PD. So what you have to remember is your eyes are constantly trying to go to the center of the lenses. And if the centers of the lenses are not in front of your eyes might want to go up and down or side to side. It can give you headaches and make you uncomfortable. But if you're going to buy glasses online, the one thing that I need you to know is you can never, ever, ever drive your car with glasses that you've made online. Ever. Right?
You say that. You say that to patients.
Oh, yeah. So you can't. I said, unless you've read through your entire insurance policy. Because somewhere in your insurance policy, it probably says that if your license says you need to wear correction to drive your car, you have to then wear correction. They have to be made properly by a licensed practitioner. Well, the people who make glasses online are not licensed. And just by virtue of the fact that you couldn't try on the frame and get proper measurements, they could not have been made properly, ever. They could be close, or by accident made almost properly, but they could not have actually been made properly. So if you get into a car accident and you hurt somebody, and you get into a civil lawsuit, and somehow the prosecution finds out that you bought your glasses online, your insurance company may have an out to not paying the claim because you did not live up to the policy that you signed. So I would rather you got.
That's an interesting angle. How do patients react to that?
They say, first of all, they're always surprised when I say it's illegal, because if it was really illegal, how could people be doing it? Because this is sort of, like Uber, where the government's not really ready to step in and shut them down, even though they're breaking the laws that the government has in place. It's, they've got bigger fish to fry, and they figure nothing terrible is happening. And, we at the association are trying to re-educate the government. They're letting it alone, but it's still not good, and it could be dangerous. And again, to not be self-serving, I say, look, I would rather you got your glasses just about anywhere else, even Hack'em, right? Or Lens Crafters, or, Canadian Tire sold glasses and had it was licensed. I'd rather you got them there. But I really I don't think you should buy them online. The money is just not worth it. And at the end of the day, you can buy your underwear online, you can buy shirts online, you can, color your hair in the bathroom, do anything else to save money, buy cheaper toilet paper, but don't cheap out on your glasses. Driving, your job, looking at your family, it's just not worth it.
No, did not think of the insurance angle. I'm gonna have to test that.
So colleagues always ask me, is that really true? I don't know. I'm not going to read the insurance policy, but at least if it's not true, at least I made them go read their insurance policy.
The other thing that struck me is I think you've trained your patients very, very well. Most of our colleagues out there will tell an adult patient, the 20 to 64 age group, that you need to come in and see me in 2 to 3 years. You're young, you're healthy. You've been really, really diligent about training your patients that they must come in and see you on a yearly basis. How do you educate them? How do you show them the value and the importance of coming in on an annual schedule?
It was the way I was trained by some of the mentors that I had the privilege of working with early in my career. We pre-booked everyone in the practices that I worked at when I came to Toronto, and that just became natural to me. And I always got pushback. Patients will say, well, I'm only covered every 2 years. I try not to use the word covered with insurance. I try to use the word subsidized. Insurance isn't supposed to cover all your healthcare costs. It's supposed to subsidize it so it doesn't hurt as much when you have to pay for stuff. My philosophy, and I know not all practitioners agree with me, is check everybody every year. I've had 28-year-old emetropes who have had retinal tears and detachments that I caught before they ever turned into anything serious. And I'm, again, quite emphatic about it with patients. When I do my exam, those of you who know me well know I talk a lot. Well, I talk a lot in the exam room too, and I don't just chit-chat with patients. I explain to them what I'm doing when I do all my examinations, different steps of the examination. When I do retinal imaging, I turn the screen and I show them their retinas, and I explain to them what I learned from looking at their optic nerve, and that they don't have glaucoma or brain tumor and aneurysm. I show them their blood vessels and say, I don't see any signs of high blood pressure, diabetes, hemophilia, leukemia, sarcoid, or lupus. I explain to them what their macula is. I look at their peripheral retina on the optomap and say, you have no holes, no tears, no rips, no tumors, no bleeding. It's a pretty standard speech. I can say it quite quickly, but it's very impressive still for people to see their optomaps or any type of retinal imaging. When I do OCT, I explain to them what I'm looking at. When I do HRT, I explain to them what I'm looking at. When I do pachymetry, I tell them why I'm doing pachymetry, what it tells me, what the risk factor is if you have thin or thick corneas, how it makes you a candidate or not a candidate for laser surgery. So when I've explained all that, at the very end, I say to them, we've established a very good, let's assume it's a new patient, and they've been going to, random doctors when they need to get eye exams over the last 10 years. I say, so now I've established a baseline. All your exams prior are basically gone because no one ever has continued that. I said, if you left your GP's office, who you've been seeing for 20 years, you wouldn't just leave your file, because that history is valuable for the next doctor. You need to know where you started. All of your doctors are looking for changes. We compare you to averages and normals, but we're really watching for changes. Some people have big optic cups. They're just born that way. It makes it more difficult to pick up glaucoma down the road if we didn't know that they always had big optic cups, right? So these are the kinds of things I explain to them. I explain to them the value of the baseline. I explain to them that their imaging will be very valuable to me as we get old together. And I use that term all the time, and it always gets a little chuckle. I say, look, I'm hoping we're going to get old together. You're going to come in every year. We're going to get to know each other year by year. But I'm going to be in the best position 10 years from now to say to you, Jeff, you're exactly the same as you were when I saw you 10 years ago, and I have all the images and all the data to prove it. And if you ever leave town, or if we ever get into a fight and you decide, I'm never going to see that guy again, you email me, and I will send your file with your images to the next doctor, because that is valuable information should anything ever happen. I say, and I need to see your spouse every year, and I want to see your kids every year. I say, I noticed that you live in Oakville. We're downtown Toronto. If you would like to bring your kids in, I'd love to see your kids. I love having families together. But if you don't want to bring them here, I got some great docs in Oakville. I'm going to refer you to some friends of mine in Oakville. I think they're close to your home. If that's what you want to do, they'll take great care of you. But make sure your kids get checked. Make sure they get checked every year.
Yeah, no, I like that. I like that. I like the fact that you highlight all the testing that you're doing and you're establishing a solid baseline. Because I think a lot of patients don't realize, why you're doing that. And you're right. To be honest, we look for change over time. That's really what we're doing year after year. So yeah, I mean, that's pretty compelling. If we look at all the tests you rhymed off OCT, HRT, Optomap. So I'm a patient, first-time patient. I come into your office. I find out your exam is X amount of dollars. I've got a bit of sticker shock. I'm like, holy smokes, Dr. Mike, how come your exam is so expensive?
I'm going to answer it, but the truth is it doesn't happen very often because my office is on the 4th floor. Most people don't walk into our office. They call, they ask the price before they come in. So they're usually pretty savvy, but we do get patients who have been coming, they come in for their second visit or their third visit, and they say, my husband got a checkup and his checkup was like $85, and I'm paying much more here. Why is your exam so expensive? And I'll say, well, do you know where your husband got his exam? And they'll say, oh, this guy next to Hakeem or, whatever. They may say, I got it at Dr. Goodhue's. He goes to Dr. Goodhue in Oakville. Well, then I have to bring in the fact that, in Oakville, rent is probably cheaper, and I'm downtown. So, that gets factored in. But generally what I try and say to patients is I try and get away from price, and I try and focus more on value. I think people have it's easy to compare two prices. One's high, one's low. Value is a bit more difficult one to compare, but it's a more important one to people because people will spend money on things that they can see value in. You need to show people value. I mean, you either have, if you're going to try and command respectable fees for what you're doing, people need to understand why they're paying what they're paying, and they need to say, it was quite a bit of money, but that was a good exam. I trust that guy, or he tested everything and he explained everything to me. The other guy didn't do that, and the other guy was cheaper, but this was worth it. So it's the value proposition that I always try and highlight. And I will explain to patients that, the Ontario Association of Optometrists has a fee guide, and that our fees are actually in line. We're not the highest. We're in line with the fee guide, and that we do survey the marketplace. Again, my office is in a densely populated or a densely OD populated area. If there were no walls on my practice and I threw a baseball in any direction, I could probably hit another practice, and I don't have that good an arm. So, there's lots around me, and I know what everybody charges, and we're all, somewhat similar. So if they want to stay in the neighborhood, we're not priced out of range, and we're not even the most expensive.
Yeah.
So I say to them, look, so that's sort of where our price is. And what I would put to you is, if you sit through the exam, I think you'll see that this exam will likely be quite different from your previous exam. Again, I've already asked them where they got their last exam. So, if I know they went to your office, I might not say that because I know you do the same exam that I do. So I would be wrong in making that statement. And I have a pretty good sense of what goes on in the city. Mm-hmm. So I'll try and highlight the fact that our exam is priced fair, and the exam that you got was cheaper. And as my wife's 96-year-old grandfather still tells me, cheap is a statement about quality, not about price. There have been times, not often, I say if at the end of the exam you don't feel I was worth it, I will refund you the difference of what you claim was the other price. But I bet I'm going to, and then then you got to give, as Nish always says, I do, you got to give your A game. You got to show them the best eye exam. You have to wow them. You have to explain everything. You have to tell them what the equipment is doing and how there are different types of equipment, but this is the newest one. And, and you don't use the puff, you use, which they hate. You use a tonometer, and why, a Goldman tonometer is maybe a little bit more accurate than a puff and certainly way less annoying.
My sense is, Mike, I think you bring your A game to every patient that you see. I mean, obviously you've got some great scripts and you're speaking from the heart. My sense is that you treat all of your patients that way. And I think that's got to have paid off. I mean, you started your practice when? You said 2010?
Yeah, I mean, I didn't start my practice the way most people start their practice, in that the practice that I had followed me. So I had quite a full practice when I opened. So
right, but to build it, you've got associates, you've got you've expanded your floor space recently. Obviously, you're doing a lot of things right.
I mean, I try to. I'm sure I make mistakes, but like I said, I've always had great mentors. I still have currently great friends and mentors like yourself and the rest of my OD friends. And part of being part of the community, the OAO community, certainly has afforded me a lot of introductions to people who have taught me great things or made me up my game. And I don't know how to do anything but my A game, and I don't know which patient, even that most annoying patient who's OHIP covered and griping and doesn't want to buy. I don't know that they're not friends with some great people who they can refer to me, or that they're the person who, if I don't give my A game to, is going to go write a bad review about me. So I tell my staff and I tell my patients, every patient interaction you're going to have is with someone who's going to go review you somewhere, whether it's over coffee with their spouse when they get home, or whether it's online to the entire world. So you always have to bring your A game. And if you bring your A+ game, maybe they will go review you and say wonderful things about you. And that can do nothing but help your practice.
I like what you said about, learning from your colleagues, your mentors, folks at the OAO. And, I really appreciate you sharing a lot of these tips and what you say to your patients, patient communication with the rest of the membership. I think whether you've been out for 1 year or 30 years, I think by listening to you, I think everyone's going to walk away with some pearls and some tips. So,
yeah, my pleasure. I hope you've learned maybe some of the things, if not exactly what I do, then a version of it, or maybe you're looking at some of the things I said and say, yeah, I would never do that. But you still learn something. That's great. That's the great part about the OD community that we have, certainly here in Ontario. We've got a lot of like online groups, the OAO LinkedIn group, where people share information and we all learn. So
yeah,
this makes us all better. That's where we should all be going. We should all be trying to get better.
Okay. Well, you've certainly helped us do that today, Mike. I appreciate it. Thanks again.
My pleasure.